Very good morning to the respected team. My topic is an exploratory study of a novel application on a PC software to evaluate the color contrast sensitivity. The aims and objectives of my study were to use an Adobe PC software to design a new test to determine the color contrast sensitivity and to standardize and study the range of color contrast sensitivities for the three basic colors, red, green, and blue, in subjects of varying ages, genders, refractive states, and eyes with and without intraocular lenses. The materials and methods: we did a prospective case series on 150 subjects, including both the eyes, who were cooperative and consented for the test, age being more than 5 years, the best corrected vision of 6/9 or even better, and had the normal pupillary reactions. The study was conducted on Adobe Photoshop version 7 on an Apple MacBook Pro, which had the advantage of providing the retinal display. The test was standardized for three basic colors, red, green, and blue. The testing distance was set at 1 meters. For each of the RGB colors, the software allowed for the color brightness alterations in percentages and the preset values of color units varying from a minimum of value 0 to maximum of 255. The background value was set at 255 color units and the foreground values were reduced to 240 color units stepwise. The greater the foreground background difference, greater was the contrast. This is the software image where we could see the RGB colors being set minimum at 240 and maximum at 255. Saturation was set at 100% for all the three colors and brightness ranged from 94% to 100%. And this is a hue which, according to a representation on color wheel, has specified values of 0 degrees for red, 120 degrees for green, and 240 for blue. On a slide, 6 letters were presented in two rows, the font size having 49 millimeters, which is according to standard Pelly-Robson chart. If patient was able to read 4 out of 6 letters, it was considered a good response. At first, we decreased the letters' color units in order to make them appear darker till the subject could read more than 4 letters. And then the process was reversed, making the letters lighter to compare for the effects. The difference in color unit as a proportion of maximum background color unit was the threshold for that color, and its inverse represented the sensitivity. The maximum and minimum contrast sensitivity as we calculated were 256 for the maximum and 17 units as a minimum. These were the images. As for blue color, this is a slide which is showing the maximum threshold and thus the minimum sensitivity. And this is with the minimum threshold and the maximum sensitivity. Similar were for the green and the red colors. The results is obtained on study conducted with 86 males and 64 females and 45 pseudophakic patients, with 18 having IOL in one eye and 27 in both the eyes. On comparison with age, we could see that there is a decline in the contrast sensitivity with increase in age, and the test was significant with p-value of less than 0.001. On comparison amongst the colors, there was a strong positive correlation, since one being affected, the other will also have the same effect. And in the myopes we did study, although the number was less and the power taken was up to 5 diopters, a significant but very minimal positive correlation was observed. On comparison with the patients with IOL and without IOL, a better performance was seen in the eyes which were having no surgery done, that is non-pseudophakic, in comparison to the eyes which were pseudophakic. However, no association was detected with the hyperopic patients, and neither any difference was noted between the two genders. Thus, we could conclude that we have demonstrated the possibility of using this PC-based software to assess the contrast sensitivity in normal subjects as well as in those with IOL, and in future we can explore this to assess the ability of people who need to function in poor contrast environments like the nature photography at night or action against the enemies in darkness. And there is a very easy availability of this PC software, so we can validate the use of this test to find a use in our clinical workup of patients. Thank you.
Thank you, Doctor. Judges, questions for her, please.
I like the use of this software It's an innovative thing and very easy. So, very good idea.
Thank you, ma'am.
Think you should work on this further and validate it and bring it in the market.
Absolutely. Patent